Welcome back to HealthWise. And with us again is Dr. Granger. And we were talking about cancer. Doc, what's the main thing people should do? I know, there's a lot of tests that you can do to catch the cancer, and mainly let's talk about stomach cancer.
Well, in regards to the best thing you have to do is practice preventive medicine. In regards to stomach cancer, also, for example, in regards to colon cancer. The American Cancer Society and the American College of Surgeons made a statement 10 years ago that patients over 40 should have colonoscopy. Therefore, what you do, as we all know, polyps are precancerous tumors. So if a patient has any change in bowel habits, Reggie, they start passing blood per rectum. They have a family history of either their parents or grandparents of polyps or having multiple polyps in their colon. They have inflammatory bowel disease, Reggie, like Crohn's disease or ulcerative colitis. Then they should be checked early. But you are also, if you also pass bright red or dark blood per rectum, then you need to be scoped, and which is called colonoscopy. And the things you're looking for when you scope patients or colonoscopy, you're looking for internal hemorrhoids, Reggie. You're looking for inflammation of the colon lining. You're looking for polyps. You're looking for blisters in the colon, which we call diverticulosis. And you're also looking for colon cancer. And the other end of the spectrum, which is, like you said, gastric cancer, a patient may present with weight loss, lack of wanting to eat, vomiting blood, then you need to scope them from above. And when you scope them from above, which is called gastroscopy, you're looking into their esophagus, their stomach, and their duodenum. Then you can verify to the patient whether they're bleeding from ulcers, dilated veins in their esophagus if they have cirrhosis, or cancer of the stomach. And to prove that, when you go in the stomach with the scope, if you see an abnormality, then you take a biopsy. And then when that biopsy comes back after 3 days, you can inform the patient credibly what they have in their stomach.
Okay. Doc, we were talking about that, and I know men have a problem with getting not only colonoscopies, but prostate checks. How often should I know they say over 40, how often should someone over 40?
I feel that a patient should see their family doctor and their urologist every year after 40. And they should get that special test, which we call PSA, which stands for prostatic specific antigen. And the normal for it is 4, but they say now in the recent literature it can go as far as 2.9. But if your family doctor feels the prostate and he feels a lump, then he sends the patient to a urologist. Then the urologist will biopsy that lump and then also will get a PSA. But 40 yearly. It's a kind of cancer that creeps up on you, and you don't want things to creep up on you. Take care of yourself first, then you can better take care of other people.
Sure. I know, and I hear guys talk all the time, and everyone is like, man, I'm not getting that test done, whatever. But it's worth it rather than risking your life, because people that I do know that didn't catch prostate cancer in time, it's a very fast metastasizing cancer where, before you know it, it's all over your body.
Yeah, and it's the type of cancer that can spread to your spine and your bladder. So preventive medicine, I think is the great fear to see a urologist, but the urologists are excellent. They would allay your fears. Then you have the exam, and after the fact you say, now why was I so scared to see that urologist? Do it for yourself and your family.
Mm-hmm. And I know I'm just as guilty as other people, because now I'm better at it, you know, every year I try to go, but I know when I first turned 40, I was like, oh, I don't need that, and, you know, I'm not going to go. And after talking to friends of mine that were doctors, I realized, you know, man, this is something that, you know, and seeing people that had prostate cancer and didn't catch it in time, that it was something that we needed to do. Kind of getting off the subject, you mentioned to me earlier that you're the only doctor that speaks Cajun French to your patients, which is something I know dealing with the elderly, especially a lot of elderly patients, they don't speak much English, so it's kind of hard for them to.
I was fortunate because at this point in time, I'm the only Cajun French and Creole French speaking surgeon in St. Landry Parish. And I can tell you, I work on a referral, Reggie, and 50% of my patient clientele, I speak to them only in Creole and Cajun French, which is an asset for those patients. They understand what's going on. You make them feel more comfortable speaking their language. And then when they're having the procedure done that they have to do, they know they can communicate with their respective doctor.
It really helps, I think, because, you know, like I said, I know working in the healthcare field, as I do, every now and then, especially among the elderly, we meet someone and they start speaking, and I'm a younger guy, and I never had you know, I learned a little Parisian French in school, or European French as they call it, but it's different from the Creole Cajun French. So I can understand a little bit of what they're saying, but I can't really speak what, you know, fluently. So it's kind of like picking and choosing. So I know it allays their fears and makes them feel comfortable with, and, you know, I think that's something that, especially if you have elderly parents or whatever, that you need to know, hey, Dr. Granger can speak with the best of them.
Well, I usually start speaking to them initially in Cajun or Creole French, and after once in a while they say, I don't understand, could you speak English? And I tell them that's fine, but I was just testing you out.
To see, okay. Well, Doc, we're going to talk some more about different cancers when we come back from this message from our sponsors.
Thank you.
All right.